we're going to go ahead and continue this is called the osteotomy. I want to get technical with you guys, all right? It's not a hole, it's an osteotomy. So we're going to go ahead and continue to prepare the space for the implant. It's a very gentle, people think, oh, you're drilling, we're not, it's not a noisy drill. Look, it's an electric drill. It's very slow. And as you guys, you can hear me speaking because it's just not the typical dental drill. And that's basically it. Do that a few times. And there's no reason to be put to sleep for this unless you want to, but there really is no need. We got some nice music playing. And it's a very gentle motion. Accommodate the implant. And each time I go ahead and drill, I can feel the bone. I can tell if I can go to the next size. So I'm always assessing the bone density. So right here. And you just saw what it is to drill a site for an implant. Now we're done drilling. Now we're going to get the implant, which is here. So like I say, it's 80% planning, 20% execution. The execution's easy, but we make it easy. Without the proper planning, we'd still be here measuring and trying to figure it out. There is no doubt as to where we're going and what we're doing. And there it is. That's the first implant. It's got the healing cap, and if we let go without stitches, all I had to do is push. The gums basically are approximating. They're holding themselves together. So I have no doubt she's going to heal perfectly. Yeah, great. So at this point we already finished the preparation. We did the small hole. We placed the implant. Right now what I'm using is the final step, which is a torque wrench. We want to know exactly at what torque the implant's going in. And in her case, she's got really good bone. So if you look at this is my torque wrench. I have different settings on it. And I'm going to go ahead and introduce it. And you see how it snaps? So now I know exactly what torque value, how much resistance, how dense the bone is. Patients with osteoporosis, patients with osteopenia, they're going to have a different reading on this torque wrench, and that's going to influence how long we're going to wait to load, to put teeth on those implants. And if I had to go down with a weaker setting, we'd let this heal longer. The plasma is going to help patients with those less than perfect bones to heal quicker. Okay, so we're going to get a much denser bone later on down the line. So once again, even though we know she's got good bone because we already did the right side, we're always checking bone density as we're in surgery. So the CT scan is one of my tools, but nothing replaces the hand and the connection, okay? So the implant's finally placed, and because it is very strong, we're going to place a healing cap. What that does is it minimizes surgery. I won't have to do another surgery. When she comes back in 4 months, we're ready to make an impression, send it to my lab technician, the artisan, and he's going to go ahead and make the teeth. Okay, so let's go ahead and put the healing cap.